What are the benefits of early diagnosis of hemorrhoids? In the sense that many patients continue to suffer without letting it be known to their doctor or the physician, and therefore consulting a surgeon earlier on the course of the disease is very important. And just in the beginning, I'll give you the classification that it has been graded into grade 1, 2, 3, 4. Grade 1 hemorrhoid is when there is initial swelling of the internal arteriovenous plexus, which is just above the dentate line in the upper part of the anal canal. And grade 2 hemorrhoid is when it swells and comes up to the you can say the anal verge. Grade 3 is when it prolapses outside, but it goes back inside spontaneously. And grade 4 hemorrhoids are the prolapsed and hemorrhoids which do not go back. So basically, these are the rough grading which all the clinicians follow. And this also, the patient should also know that what kind of hemorrhoids they are there. And associated with this is the bleeding part, which can be present in any of these grades. Most common in from grade 2 to grade 4. So early diagnosis definitely has to be done through a clinical examination, and that is a simple digital rectal examination (DRE) and a simple proctoscopy, which can be done in the OPD of any surgeon. And that is important to diagnose a hemorrhoid and rule out other coexistent problems which can also present like hemorrhoids, which we'll discuss, I think, later on. So as I said that getting a diagnosis by a proper surgeon or a clinician is very important, a gastroenterologist, because hemorrhoid can be associated with certain fatal conditions, or rather I should say serious conditions, which are often ignored, especially in the 4th and the 5th decade. And these are like, right from inflammatory bowel disease to what you call it as malignancy. Sometimes hemorrhoids can be leading to malignancy present in the rectum, which can also present with GI bleed, the lower GI bleed and fresh blood in the stool. Often patients confuse presence of a serious disorder with hemorrhoid. Therefore, the diagnosis is very, very important, and it should never be diagnosed based on the history, but it should be diagnosed based on a proper, simple and OPD based clinical examination, which is DRE or digital rectal examination, and a simple proctoscopy, which is available in every surgeon's or clinician's OPD. Therefore, this is done to rule out other problems which can be associated with such a benign condition as hemorrhoid. So a hemorrhoid or a bleeding from occurring in the stool should never be taken lightly, but should be properly diagnosed. In those patients who present with blood in the stool, let's say in the 6th and the 7th decade, then those patients also need to be evaluated thoroughly and just not diagnosed with hemorrhoid and written off or given treatment. These patients, depending on the symptom, depending on the presentation, they can be subjected to a simple sigmoidoscopy to rule out any proximal lesion, ulcer, or a malignant ulcer or a malignancy, especially in the older patients. So, most of these patients actually are coming with symptom of number 1, discharge per rectum, number 2, something mass coming out of the anus while they are defecating, number 3 is bleeding, that means blood in stool. Now the bleeding which is associated with internal hemorrhoids is often fresh and red. That's because of the peculiar nature of the anatomy over there. Actually, there is a clear-cut the atriovenous, you can say, communication, and this plexus which is there, which is known as the anal cushion, and this venous plexus which is present in the submucosal part gets engorged due to constant straining, and then leads to the evolution of hemorrhoids in various grades. That is why it's often asked that why the bleeding, even though it's a venous plexus, but why the bleeding is often red, because there is also an arterial component to it. And that is why many a time these patients complain of spurting, or there is a flow of blood immediately after defecation, because the mucosa overlying gets eroded and the blood vessels are exposed and they bleed, and sometimes it can be alarming bleed. Rare circumstances, it can be a very serious kind of bleed which warrants immediate attention and admission to the hospital, blood transfusion, or uh, an urgent kind of intervention or surgical intervention to stop the bleed.